Good morning, it's early August 2020. I'm here in Cooper in Fife. My name is Douglas Abercrombie. I am a myeloma patient, diagnosed in July 2018. Luckily, there was an issue with that diagnosis insofar as my family doctor, my GP, had one patient who had experience of exactly the same condition and symptoms, and from that, luckily, he was able to send me for tests, but I'll come to that in a moment. Initially, the symptoms that I presented when I first thought there was something wrong was that I was losing my ability to concentrate. I was losing memory, just not functioning properly, and I didn't really know what was wrong. That probably started in the year 2015 into 2016, and I really didn't know what was wrong with me, but I knew there was something wrong, and I just wasn't right. I put it down to other stresses in family life and other issues. I didn't really think it was down to an illness at all. Then, around early 2017, maybe in the middle of 2017, I developed a very painful back, very sore back, certainly between the shoulders, and I had been moving furniture, household material to some extent, and I put it down to a pulled muscle, torn muscle or something of that nature, that had hurt my back in some way. So I went to my GP. It turned out on that occasion that it wasn't my actual GP, it was another lady doctor who gave me a brief examination and said, well, I don't really know what it is, it's probably a torn muscle, but go away, and if it persists, if it doesn't disappear in the next few weeks, then come back and see a doctor. So I tried various pills, I tried various creams, ointments, and they certainly helped, but the pain did not go away. So a number of weeks later, I went back to the doctor, and it was my own GP this time, Dr. Gurley in Cooper, and he gave me a thorough examination, and he was obviously quite concerned about my situation. I explained all the various symptoms, and he was very interested, and he then said, well, I want you to go for x-rays and for an MRI scan. I thought at the time that was a bit much, that was over the top, but that's what he wanted, and as you do, you do what your doctor tells you. So I went off to St Andrew's Hospital for the x-rays, and in due course of time I also went to Dundee Nine Wells Hospital for MRI scan. Quite a scary experience inside that huge machine. Quite claustrophobic, but got on with it, no problem. And obviously some 2 or 3 weeks later, the results came back to the GP, and he arranged an appointment for me to go and see him. I duly did, and he said, well, when I got into his surgery room, he said, you know, you better sit down, I've got some bad news for you. And I said, well, you know, what's the bad news? This was quite a shock, quite a surprise. I wasn't expecting that at all. He said, well, I think you've got a condition called myeloma. Now, of course, I had never heard of myeloma at all. I wasn't familiar with the word or the condition or the disease, didn't know anything about it whatsoever. He said, well, myeloma is a form of blood cancer. He said, and it affects, amongst other things, it affects your bones and your immune system. The effect it has on your bones is it causes them to weaken and to crumble, He said, that is what I think is wrong with you. And he says, the x-rays and the MRI scan have confirmed that 2 of your vertebrae and the top of your spine are badly affected, and 2 of your vertebrae at the bottom of your spine are badly affected. And he said that would account for the pain and the discomfort that you've been suffering. So he then said, well, he said, I cannot definitely diagnose myeloma. That needs to be done by the proper haematology team down in the Victoria Hospital, Kirkcaldy. So I'm going to make you an appointment with the consultant there, and they would take a blood test done, and they can then take it from there. So the blood test was done, sent away, and I duly went a few days later for the appointment at the Victoria Hospital, where I met with the consultant, Dr. Rogers, a very experienced consultant who'd been involved with haematology myeloma for a long number of years. He had received the results of the blood test, and he said, yeah, you've definitely got myeloma. Now, in the meantime, before that appointment, I had done some study, some reading on the subject of myeloma and about cancer as well, because cancer is obviously a nasty word, and it's quite a scary term. So I looked it all up, and I picked up on the fact that cancer has quite often got 4 stages, number 4 being the worst of the bunch. So one of the questions I posed to him was, what stage am I at? Because that affects your potential for surviving. And he said, look, he said, it doesn't matter what stage you're at. He said, that doesn't apply in this particular condition. He says, you have got myeloma, I am your doctor, I am going to treat you. That was quite straight talking, which I appreciated. And he then said, right, the treatment is going to start practically immediately, as quick as we can get it organised. So I then said, well, what does that entail? He said, well, it really means chemotherapy, and then eventually radiotherapy, which will ultimately lead to stem cell transplant. And if that is all successful, then he says you should be able to have a fairly normal life, and that life should last for a reasonable amount of time. I said, well, how much time? He said, well, nobody knows. He said, everyone is different, and you just have to get on with it and just take what you're given. I think the phrase occurred to me at the time is that you do not get what you deserve, you get what you're given. So I accepted that, and within a few days the regime of chemotherapy began. What he was maybe reluctant to explain, which he eventually did, was that part of that involved self-injection, which can be daunting for some people, but I just accepted it. So the treatment regime was chemotherapy, which involved 2 chemicals, one of which was thalidomide, and that is part of a universal worldwide treatment. I forget what the name of the other chemical was, and then there was a steroid, and there was an injection that went along with it. And this course of treatment was, I think, for a period of months. I think it was a number of cycles of treatment, during which everything is monitored: your blood pressure, your blood tests, your height, your weight, all kinds of things. I think they also even checked my teeth, because apparently your teeth can be badly affected. But everything was well there, and effectively we got on with it down at Kirkcaldy, and it was a case of a number of cycles of this chemotherapy treatment. That went on, and I was just glad to be able to be receiving treatment, and just humbly getting on with it. I have to say that my wife, who I'm now separated from, Sheila, was of tremendous help to me then. She accompanied me to all these visits and all the treatment sessions, which were quite daunting insofar as they didn't leave you feeling all that great. The chemotherapy was certainly left you a bit down, and you felt weak and didn't feel nice at all, but it just had to be done. You had to accept it. And then another incident occurred in the course of all that. The chemotherapy, I have to say, weakens your immune system, and I found that out very much to my cost. I think it was October in the year of 2018, 3 or 4 months after diagnosis, that I stupidly walked out the flat where I was staying to go to a post office maybe a mile and a half away. And it was a cool damp evening, and however it happened, I contracted pneumonia. That would be, I think, on the Monday, I think it was. On the Tuesday, I was over at the Western General in Edinburgh, receiving one of my sessions of radiotherapy, which they were using to try and sort out the 4 vertebrae in my spine that had been affected. And in the course of waiting for that treatment and the aftermath of that treatment, I felt really horrible, really bad, shivery, feverish, and just out of it. I could hardly keep my eyes open. I was just shattered. So on the way home, I slept most of the way, and when I got back to my flat, my ex-wife was with me, and she said, "You don't look very good at all." She said, I don't think you should be staying on your own tonight. You just don't look good." So she brought me back here to Cooper, and I obviously deteriorated very quickly. And I then started, I'll not just say shivering, I started shaking. My whole body was just shaking uncontrollably, and my temperature went way up. She was able to monitor that. So she called, I think it's 111, and the advice was get an ambulance. So an ambulance duly turned up, and the 2 ambulance guys basically got me out of the house, down the stairs and into the ambulance with some difficulty, because I was very weak. I was hardly able to walk, and they blue lighted me down to Kirkcaldy, to the Victoria Hospital, where I was admitted to the emergency part. I was very quickly diagnosed with pneumonia, and then mysteriously I was put into a side room where I was left for a considerable period of time. I don't know how long it was, 15-20 minutes perhaps, and nobody came near me. I thought that was very strange. And eventually a nurse came in, and I said, "Look, what's happening? What's going on?" And she said, "Oh, I'm not really sure." I said, "Well, I would be very happy if you would please find out." And she went away. In the interim, I heard 2 female doctors speaking outside in a corridor. I couldn't hear exactly what they were saying, but I got the distinct impression they were talking about me. And I also got the distinct impression that they were discussing whether I would be treated or not, whether I would survive or not effectively. I wasn't very happy about that. Anyway, the nurse came back, and I said, "Look, I don't know what's happening here exactly, but I want to be treated. I don't want to be left here. So if you could please find out what's happening and let me know." So she went away, and a few minutes later she said, "Right, we're putting you up to a ward, and you will get treatment in the form of antibiotics." That duly happened, and I was in a really bad way for several days, but the antibiotics kicked in along with the oxygen that I received. I was flat. I could hardly lift a finger. The nurses had to do everything for me. I would pay nurses double for the work that they do. And eventually I improved. I got better, and with the oxygen, which they eventually stopped, the coughing and the The breathing problems eventually got better, and after I think 8 days, I was given the various tests that they do, and then they let me out. I was very, very weak, and I had to come back to where I could be looked after by my ex-wife, and I was in a bad way, but I gradually got better with good food and good treatment, and I started walking around the garden with crutches, and ultimately I was at a stage after I think 2 or 3 weeks that I was half roads able to function properly. Quite a scary experience. Then of course I had to go back and continue with the chemotherapy regime and also the radiotherapy regime. Radiotherapy wasn't too bad, not painful, not any problem really. It just meant going over to Edinburgh to receive it. But all that was done, and ultimately they said that the treatment was successful and there was no more action required. By this time it was January 2019, and they decided that I should go into the Victoria Hospital, where I would receive another form of chemotherapy, and this chemotherapy was to help my body prepare for the stem cell transplant. That involved, I forget how many intravenous procedures over the course of one night in that hospital. It must have been around 15 or 20 different procedures, till eventually it was all completed by 8 o'clock the next day, after going in at 5 o'clock the previous evening, and it appeared to be successful, and within a matter of a week or so went across to the Royal Infirmary in Edinburgh, where they conducted the stem cell transplant. The stem cell transplant procedure, the precursor for it, involved taking stem cells from my blood. So they would take blood from one arm, put it through a machine where the stem cells were separated, and then what was left in the blood was pumped back into the other arm. That procedure took about 5 hours, and you had to be seated the whole time. Not a nice experience at all, and something that anyone who goes through that procedure should prepare for. It's very uncomfortable and just not a nice situation to be in, but there isn't any alternative, there is no choice. Anyway, they managed to collect sufficient stem cells, I think, after 3 procedures, and they called it quits after that. And I then was offered a date for the stem cell procedure in the Western General in Edinburgh. There was a preliminary visit. The nurse there, whose name escapes me, but she's very well known, she spoke to myself and my wife and explained the whole procedure, explained how everything was done, what would happen, how long I would be in there, which was expected to be around 3 weeks, 21 days or so. And that was fine. It was really good to be able to have all that explained in simple, straightforward terms, because it's quite a daunting prospect. It's quite a regime to have to put yourself through. But again, there was no choice, no alternative. It had to be done. So I went in, and in a ward of 4 beds, I think, the first night. Not a nice situation, but again, that's the way it has to be. And then the following day, I was given a course of chemotherapy, which was a really heavy dose, apparently, of whatever material it is. And as part of that, for example, they had to give you ice lollies because your mouth effectively dries up. That procedure also involved the insertion of a PICC line, a PICC line. That was an interesting procedure, but that was accomplished. In my right arm, and some sort of tube comes down into your chest, and that enables them to deliver the chemotherapy, etc., as part of the treatment. So I was then moved from that ward of 4 into a single room in the sort of hematology ward, with other patients suffering from myeloma and also leukemia and who knows what else. And a couple of days later, I then went through the stem cell transplant procedure, where my stem cells that had been harvested at the Royal Infirmary some weeks prior were then brought out from cold storage and effectively pumped back into my body. During the course of that, I think it took quite a number of hours, and quite a long, laborious procedure where you're just lying there and all these nurses and other people are fussing around you, trying to sort you out. No fun whatsoever, but that's the way it has to be. That procedure was completed, and the nurse explained at the time, you're going to feel very, very unwell. You're going to go right down. That might last for 2 or 3 days, and then hopefully the treatment will kick in, and your body will react favourably, and you'll start to feel better again. That was quite prophetic, because I certainly did go down to rock bottom, flat on my back, hardly able to move, feeling totally out of it, and thinking I'm not going to get through this, I'm not going to survive this. And I was probably quite right insofar as that by this time, I didn't know, I had contracted 3 infections. They think possibly from the PICC, the PICC line, but don't know. But these 3 infections certainly knocked me sideways, and they could have taken me out. But again, intravenous antibiotics, paracetamols, whatever, pulled me out of it, and I survived. I think I was in there for 18 or 19 days, gradually got better, not able to eat very well. I could drink milk, I could drink iron brew, made in Scotland from girders, and that I think saved my life, as did the porridge and 1 or 2 other aspects of the food that I was able to take. I was confined to my room for quite a number of days, unable to go out. Eventually I was able to walk around the room. I actually counted the number of steps that took, and eventually they let me walk around the ward, and I was able to count the number of steps there too. Not a good situation, but no choice in the matter, and I always thought, well, there are people worse off than me, and of course there was. Insofar as, for example, I had to go down for x-rays on a couple of occasions, down to the sort of basement level of the hospital. I was taken there in a wheelchair by a porter, and we had to pass, for example, the children's cancer ward, and that makes you think about life and its various forms. Not nice. Anyway, I was there, got all the x-rays done, got all the treatment done. One of the consultants came round one day, and he said to me, well, would you be willing to act as a sort of guinea pig for student doctors? Would you be prepared to let them question you and examine you in relation to this condition that you have? I said, yeah, sure. And that duly happened. I put myself up, and I was approached by one of the student doctors. She was the sort of the victim, who was obliged then to asked me all kinds of questions, personal and whatever else, about my condition, and I had to answer them directly and not give him any more information. And the objective was that he had to learn about my condition, learn about me, by asking questions, and he did it quite well. And the rest of the students were able to learn from that. The consultant at the end of the procedure basically added whatever other information to assist them in their knowledge and understanding of the condition. So I was glad to be of service. Anyway, I got out after I think 19 days. I was delighted to get out, to feel the wind and the rain in my face again, to get the fresh air, to get away from the hospital regime and the hospital smells and all the other unpleasant aspects of having that condition and being stuck in a hospital. But again, I have to say that the nurses were absolutely brilliant. They did everything for me, and I would pay them double, if not treble, for what they do. I was totally delighted with them, and I hope that the wee gifts I left for them were enjoyed and were fitting for what they had done. I got back, and it took me quite a number of weeks to recover from that procedure and to get fit again. It might even have been a period of months. I think the procedure was carried out on the 1st of March. I didn't really feel all that well or all that able, I think, until late April, or in fact into the middle of May. All kinds of family and friends helped me, and by this time bought a new house, and they helped me to move in and to sort out furniture and all other kinds of material, and I was very, very grateful for that. Since then, that was last year, and it's now a year and more since I recovered, and here I am. I've had the quarterly tests, blood tests. I've had the quarterly bone strengthening infusions, and I have to say that I'm feeling fine. I've no issues, no problems. All the tests, all the results have been good. There is no sign of any paraprotein activity in my blood. No other issues are affecting me, other than I do suffer from peripheral neuropathy, where your fingers particularly feel cold, and that is just a side effect that you have to get on with. Side effects are part and parcel of the condition and the treatment, and all of that is explained in some detail in the various booklets that are available from myeloma and also from Macmillan Cancer and other sources. So here I am. Saw the consultant just on Friday. Different consultant. She seemed to be happy with all progress. There's nothing negative to report, and I don't have to go back now for another 3 months. The bone strengthening infusion procedure is now completed. You're only given so many of them before they stop. So all I have to do now is go for quarterly checks, and hopefully I will be well for a considerable time to come. But of course, nobody knows. The condition can return at some future point, and if it does, they then have to determine what treatment you can be given and what's going to happen thereafter. But that is a complete unknown. It's just something that has to be accepted, and the bottom line is that I am just grateful to be here. I could easily have gone down on at least 2 occasions, once when I had the pneumonia and once with the infections in the hospital, but I survived both them, and I'm very grateful for all the help that I've been given, not only by the doctors, the nurses, the medical staff, the cleaners, all the domestics, all the other people in the hospitals and the doctor's surgery, but also from my wife and family who have been at my side and supported me all the way. And if it hadn't been for that, I could not have survived the whole experience in the successful manner that I have. So my way of putting it to anyone who is watching this, who has an interest in this subject, who is suffering from the condition, is that yeah, if you've only started your treatment, there are tough times ahead, or as I put it, with lots of fun to be had. Your body will be punched full of holes with needles, by your own hand or by others. You'll be taking all kinds of drugs, chemotherapy, treatments, unpleasant side effects. You just got to get on with it. That's the way it is. And if, like me, the treatment is successful, then be grateful. Treat every day like it's going to be your last, and one day